But before we get started, I would like to introduce you to our panel. So firstly, we'll start with Maria on the far right. Maria Delaney is my colleague. She's the Prevention of Violence Against Women Capability Building Specialist at DBRCB. She has lots of experience in research, policy development, and practitioner support. Her areas of focus have predominantly been on gender equality, education, and practitioner self-care. Maria and I will be co-moderating the panel discussion today. Next to Maria is Casey Burchell. Casey is a marketing and communications advisor at the campaigns team at Our Watch, the national organisation for the prevention of violence against women. Casey has worked on developing and implementing Doing Nothing Does Harm, a national campaign that encourages and upskills Australians to do something when they witness disrespect towards women. Casey also works on Our Watch's other primary prevention campaigns, The Line, No Excuse for Abuse, and Because Why. Next to Casey, we have Tracey Egan. Tracey is the Gender Equity Officer at Monash City Council. She holds a Bachelor of Public Health and Health Promotion, a certificate in Training and Assessment, and is currently undertaking a graduate certificate in health policy. She has worked in gender equity and preventing violence against women in both the community health and women's health sectors prior to local government. At present, she is working across a number of settings to promote gender equity in Monash, including sporting clubs, schools, early years, faith, and council as a workplace. And next to Tracey, we have Natalie Russell. Natalie is the Principal Program Officer, Mental Wellbeing at Vic Health. Natalie has over 17 years experience nationally and internationally in public health and health promotion, including 7 years working in gender equality and the primary prevention of violence against women. Natalie holds a Bachelor of Health Promotion Health Services Management and a Masters of Public Health, and provides leadership and expertise in preventing violence against women and promoting gender equality at Vic Health. And next to Natalie, lastly, we have Claire Marshall. Claire is a public sector leader, lawyer, and advocate for equality. She has extensive experience in public sector change management and reform, systemic and primary prevention responses to violence against women, human rights, systemic research, and monitoring and evaluation. Claire currently works as a principal advisor on the independent review for Victoria Police, managing a multidisciplinary team to deliver publicly facing research, reporting, and advice towards creating a state of gender equality in the Victorian Police Force. She has previously worked as a senior lawyer at the Commission and in senior advisory roles, as well as a solicitor in prosecutions and civil litigation. She has 2 small humans, one of which is here today, and a very angry cat. With the introductions finished, let's get started with the questions. So to start with, can you all tell us about your current role, particularly in relation to the work you're doing around violence prevention and bystander action? Maybe we'll start with you, Casey.
Thank you for having me and everyone for coming along to join us today. My role, I think, is pretty covered in my bio, but so I work at Our Watch. I'm a member of the campaigns team. We sit in the marketing and communications department. So our team really focuses on taking the knowledge that the sector has and that Our Watch has and the research that we do and turning that into public-facing campaigns. So that tends to primarily look like advertising and supported by websites and the resources that sit there and support members of the public or practitioners depending on our target audience. So my role is about supporting that end-to-end implementation of a campaign, so working with our research and evaluation team to develop a target audience, to talk about what language speaks best to those people about the issue that we're trying to talk about, and then kind of supporting and working with our advertising agencies and media agencies to turn that into visual products and into something that someone can watch or listen to and ideally be influenced by, so that their behaviour is changed in the way that we want it to. And so we bring to that kind of cross-team project, we bring ideally the expertise or just a lot of opinions about what that behaviour change should be and how we consider that a success at kind of the end of the day. So it's a marketing role, I suppose, but I think particularly not-for-profit, when we say we work in a marketing role, we all go, ooh, how boring. But ideally, we're kind of, bringing that expertise to really help our watch, in this case, articulate the messages that we're trying to get across to, influence people's behaviour in a really positive way to prevent violence against women.
Good morning, everyone. So I'm Tracey and I work at Monash City Council as the Gender Equity Officer. And so in terms of my role, I think it's very much in terms of how to bring the bystander campaigns into that localised area. So we work across a number of different settings, and I think given, the television advertisements and the more discussion in terms of what your role is to prevent violence against women, in the last couple of years I have noticed that more community members are wanting to know how they can speak up and take action on bystander. So in terms of my role at the moment, I'm very much working with our sporting clubs and also our faith communities, and also exploring what Monash can do as a workplace to be an active bystander. And so I just feel like the time is now in terms of really working with that community on this topic.
So in terms of my role at PiP Health, I guess where PiP Health sees itself in relation to the promotion of gender equality, and particularly in relation to bystander action, is that since about 2011, we've really strived to build the evidence base around what works in relation to bystander action, and then how we transfer that knowledge to other organisations, communities, settings, etc., in really practical terms. So for me at the moment, I'm working on a particular project which looks at how we can use behavioural insights theory and apply that theory and principles to the problem of bystander inaction, particularly in relation to sexism and sexual harassment. So we've been working with the behavioural insights team and the Office for Women since about mid-2017 to both analyse the behavioural insights theory and then look to apply that theory to the problem of bystander inaction. And through the scoping of the literature, we've found that there's real possibility and feasibility of undertaking some randomised controlled trials within a number of different settings, such as universities, workplaces, transport, and the hospitality setting, like pubs and bars. So what we've done is we've commenced this work by doing 2 trials in the university sector. So they're underway at the moment, one with VU and one with Melbourne University. And I can talk a bit more about the actual detail of those trials a bit later on.
Hi everyone, and sorry about my baby, I think she's back. So I currently manage a team at the Victorian Equal Opportunity and Human Rights Commission, and we are auditing and assisting Victoria Police to reach an organisational state of gender equality. So back in 2015, we did a bit of a deep dive into the organisation to understand why there were such critical levels of discrimination and harassment amongst Victoria Police's ranks, with the understanding that there were some really critical systemic levers that we had to look at to improve the outcomes for female employees. Over the past 3 years, we've been going back in and delivering on our agreement to help them to implement a number of recommendations for systemic reform across their entire workforce. Through that journey, we've delivered a bunch of public-facing audits telling them what's going well and what isn't, and we've seen improvements in relation to promotion and progression of women and so on, but still really critical levels of harm across the organisation. One thing I'll pick up on a little bit later is a really interesting link we've found between the capability of frontline workers and how safe and respected they feel in their workplaces. And that links back to an increase in people being able to say and call out when things are inappropriate in the workplace setting. So in July this year, we're delivering our final audit of Victoria Police, and there's some really exciting change happening, but also big steps to go. So I'll talk about the detail more later, but that's what I do.
So, Natalie, when we talk about bystander action, some people think we mean physically intervening in a violent situation. So in the context of primary prevention, bystander action refers to a very different kind of concept. So can you explain what bystander action is and is not in the context of primary prevention? Thanks.
So when we talk about bystander action, we're really talking about someone who witnesses or hears about a particular incident in relation to gender discrimination, sexism and sexual harassment. We're not talking about someone who physically intervenes in relation to violence or sexual harassment. It's more about those precursor behaviours. And so in relation to those behaviours, I guess what we've looked at in terms of the literature is coming up with classifying various behaviours that an active bystander can undertake when they see an incident of gender discrimination, sexism or sexual harassment. And we've come up with sort of 4 different categories. One is the first, diffusing situation, and what we mean by diffusing the situation might be either, you know, sort of giving a disapproving look, or we call it pointed silence. I'm still trying to perfect that look. I'm not sure how you do that, but it's that sort of disapproval in a non-verbal way. And I think a good demonstration of that was the Respect Victoria campaign that was launched on Sunday, which is the one in public transport, and the man sort of gives that, you know, disapproving look and a shake of the head. So that's diffusing the situation, or it might be making a light-hearted comment. So some people might feel more comfortable making something, as you know, in terms of a light-hearted comment when they see or witness say a sexist joke or an inappropriate comment. The second category we talk about is you know, talking to the victim or the target later on. So that might be after the incident has occurred, going up to that person and saying, you saw what happened, you thought it was inappropriate, can you support them in any way to either make a complaint, or, you know, what do they need? The third category is then the calling out category, which is either calling out in the moment, so when the perpetrator makes that inappropriate comment, or, you know, does something that you would say would be, you know, it's something that is described as sexist. So it might be calling out that behaviour, or what we also say, calling out and educating, or calling in, which is one step beyond that, where it's calling out the bad behaviour but explaining to the perpetrator why it is inappropriate. And so an example of this I've used in the past might be, say you're at a women's footy match or a women's sporting match, and someone makes a comment to say that women shouldn't be on the footy field, for example. So you could call them out and say, hey mate, that's really inappropriate. You know, I don't believe that. Or you could say, hey mate, that's really inappropriate. I don't believe that. What you've just said contributes to a culture where women are disrespected and female athletes don't feel supported. So that's kind of going that next step beyond, if you like. And then the fourth category is the reporting. And so an active bystander can be an active bystander by reporting an incident. They don't necessarily have to be someone that calls it out at the moment. They can report later, you know, after the incident has occurred. So that's what we've sort of come up with in terms of different categories of bystander action. Yeah, and another thing to add is it's also, an active bystander is someone who seeks to challenge a culture that just, you know, supports or encourages disrespect towards women. So it doesn't have to be about just bystanding to an incident. And this often varies state by state, is that some people use the term active bystander to talk about responding to an incident of violence and being a bystander. You know, you can absolutely use the term active bystander, but I think there we're talking about secondary prevention, tertiary prevention. We're not talking about primary prevention.
Great, thank you. If anyone has any further comments to add, just let me know. Okay, well, we'll move on to Casey. Casey, you mentioned that you worked on developing and implementing the Our Watch Doing Nothing Does Harm primary prevention bystander campaign. So I thought we'd play an ad from this campaign in case any members of the audience haven't seen it or don't know if they've seen it. And after the ad's played, it'd be great if you could tell us about what bystander actions in the context of primary prevention look like, perhaps referring to that example of the campaign. Thank you.
Technology.
They're already in your city. Yeah, but he said it's a woman.
That's great. Cool.
There's no way a woman can run such a large company. Women are just too emotional to lead. You know what it's like in businesses? It's competitive. I don't think a woman can handle it.
So I might just, sorry, to give the full effect of the campaign, can we watch it again and start starting, sorry. Just so I can explain it well rather than me explaining it really poorly. Is there a 5 version?
Okay, so what do you reckon?
So the alternative is if you click the button, which is a little smoother when you're in your phone, which is how most people use it, etc.
What? She's alright. I'm just having a bit of fun.
Okay, we can share some pizza.
Yes.
That'd be great.
Sorry to interrupt. We're all allowed to sit down again now. Thank you. So the reason I just wanted to give the two kind of examples is because the ability to click and engage with the ad is kind of essential to the theory of the campaign. But there are 5 different versions of the ad, all at the same dinner table setting with the same group of friends. And for every one of the 5, the button appears in the top corner that has the countdown with the do something. And so in every ad, if you don't click the button, the behaviour escalates, like we saw in the first video that we watched. The inappropriate man that says something kind of worse on the same theme, it's escalated, and then you get the messaging at the end that is you chose not to do anything, and therefore, like in real life, you will continue to see disrespectful behaviour. If, like when we watched the second example, you actually click the button that's encouraging you to do something, you're taken to an alternative ending of the video in all 5, where someone does something. So in the example that we just clicked there, there's the kind of non-verbal example of the woman kind of throwing her hand up and rolling her eyes, which is getting to Natalie's point of attempting to do a non-verbal kind of show of disapproval. And then you get, the user gets the messaging at the end that is because you did something, you won't see these ads again. And that's true. We stop showing you the ad if you click the button. So in theory, that's a first step at replicating what you might experience in real life. If you say to your friend, that's not okay, or you roll your eyes, you do something, then the likelihood of you experiencing that sexism or disrespectful behaviour with that same group of friends, you hope, reduces in future. So that the kind of technology of the ad that we worked with Google on is kind of meant to replicate the real life experience of both the positives and also the downsides where doing nothing does harm to the user, to help them kind of apply their learnings from the ad to a real life situation going forward. Hopefully. That's the theory. I'm not sure that was the original question though.
Yes. No, that was perfect. Thank you very much. Yeah, I think this is an example that we could all share widely as much as possible, and perhaps reflect on scenarios in our own workplace or personal context, and even rehearse to ourselves how we might respond in line with some of those examples.
I might just add as well that each of the 5 examples demonstrates both a different action, so very much drawing on Vic Health and the examples that Natalie's just talked through, and they also demonstrate a different example or type of disrespect or sexism. So there's 2 instances of objectifying or sexual harassment of the waiter in the restaurant. There's one that's about women in leadership that we saw. There's one that's about women in sport, and there's one about primary caregivers and the idea that that's a woman's role. So I just point that out for if there is particular sectors or that you work with or that you work in, there are, some of the ads resonate with different people differently. And so, feel free they can be shared as a suite, or they can kind of be shared as an individual basis.
Right, thank you.
So we've heard some great examples of bystander action at an individual level. However, bystander action can and should also occur at an organisational and systemic level. Claire, can you explain why bystander action at an organisational and systemic level is important, and give us some examples from your work with Victoria Police?
Sure. So with Victoria Police, we really got an understanding of what systemic enablers for harm looked like. So you have environments and contexts where you permit and allow a culture to evolve where women are harmed. For Victoria Police, it meant that people were indoctrinated from the moment they stepped into the organisation, and they were around other forms of behaviour that allowed them to A, turn their heads, and B, perhaps later on down the track become a perpetrator. So when you have an organisation that large, they have 20,000 employees, it's not enough to empower individuals to make change, because the systems create the environment where harm occurs. So you needed an all-of-organisation approach, starting from all the really dry content like a strategy and policies to support people, down to ensuring that leaders understood what place they had in the work to respond to harm, and then empowering individuals to make the change. The challenge is you have people who are utterly indoctrinated. And in an environment like Victoria Police, like many organisations, you walk in and you don't leave for 30 years. And so you grow up in a culture and you evolve as a professional in a culture where people around you behave in a particular way. And to fit in and be part of the culture, you will reflect that behaviour. So when it comes to bystanders in an organisation like Victoria Police, or really any other organisation where there is a particular power relationship or a particular hierarchical relationship between employees, and the harm looks a particular way, where it's very, very gendered, as we know in some of these contexts, and where the harm is often everyday sexism but escalates over time to very egregious violence, you need to be able to address a case for change, or a business case for change, really. You need to say to that person who's been there for 30 years, this is why this matters to you. This is why you need to change your behaviour. They will often turn around and say, I've operated in this environment forever. I know what I'm doing, and this isn't important. So the first step is to get that person to come around and understand. And the language of that conversation can be really, really challenging, because you're saying to somebody who, but then this work doesn't matter. It's about employee relations. It's an HR problem. It's a women's problem. And so they're not going to relate to it. So you need to find a pathway to making them really feel like it matters for them, for their capability, for their relationships, the way they manage people, the way that they can go about in the organisation, as well as having a more hardline compliance approach. When you're setting systems to make those people shift from, okay, I don't believe this work is important, I don't believe in gender equality, to actually, I've come around and I do see the value of systemic change or individual behavioural change, you then need to empower them to speak up. And that's even more difficult in an operating context that is still in a place where it's creating violence, because people don't feel safe to speak up. They might be able to identify the behaviour now, they might see the harm in the behaviour, but if they say something, they're going against this culture, and all these people around them who for the last 15, 20, 30 years have behaved in a particular way, all of a sudden you're saying, hey mate, that's not okay, that's harmful. they're putting themselves at risk, and that risk is very real, and victimisation is very real. So the systems need to step in here. They need to make people safe to speak up in a context, where we're all sitting in a mess room, for example, or on the front line, or in a context where, you're one-on-one in a van. And so if somebody says, that's not okay, they need to be supported to say that. And if something goes wrong in that process where they say that's not okay, the organisation needs to get behind them and make sure that they're protected from reprisals. And if reprisals happen, there's a proper process. It's a really big, complex job, and it's taken, I think, 26 million of investment so far, Victoria Police, to get where they are. And it's going to take another 10 years, I think, before we see any real change. But that one-on-one interaction is where people learn how to behave in an environment. And so bystander intervention, the way we interact with the person sitting next to us and the way we respond to how they talk about other people, is one of the most critical levers, beyond expensive strategies and getting leaders to talk at forums.
Thank you. Claire, I think, you've really highlighted the most critical, probably, action, and that is of systems and organisations and leadership to address these issues proactively, and hopefully it won't take 10 years to see change. But I do think quite an investment at that level is crucial, so we can be doing work on the ground and with individuals and communities, that if system leaders and organisation leaders aren't supporting that work and proactively doing this work, then it's going to take longer and be more incremental. Tracey, I'm wondering if you have any further reflections about implementing bystander action at an organisational level?
So over the past 2 years, Monash has had a partnership with Melbourne University through the Centre of Ethical Leadership, and this was to look at a number of different indicators within our organisations that impact the health outcomes of our employees. And so this was part of a longitudinal survey, and one aspect of that was asking about people's experiences of sexual harassment or gender harassment within the organisation. And looking at the data, it was really interesting in terms of that people may have heard a sexist comment, may have experienced unwanted sexual attention, but then when they were asked, have you experienced sexual harassment, they said no. And so I think it's really about what is people's understanding of this initially. So of course the compliance training, those sorts of things in organisations are really important, but this also showed us that in terms of bystander training, it is going back to the knowledge of, okay, what is sexism in the workplace. So in terms of these results, it really showed that bystander training needed to be part of revealing the results to our leadership team and looking at, how do they want to create an environment that is safe for people to step up. And so we really looked at, in terms of intent versus impact with our leadership team, what that a language might not impact you, but what impact will that have for a vulnerable employee, such as people who may be in casual positions or younger women within our organisation, because they were the ones who were more likely to say they've experienced those. So we are currently looking at how to roll out something for our employees, but we really wanted to start with our leadership team because we know that that's where the commitment needs to start. And also, obviously, the evidence through Vic Health has shown that you can't just do one-off training as well. So we're looking at what is the leadership commitment, are the organisational policies in place, what communications package can go along with that so people have it at the front of their mind to the rest of post the training. But also the past 6 months we've been very lucky to be a pilot workplace with the Victorian Equal Opportunity Human Rights Commission with a project called Raise It. And this really allowed organisations to look at a number of different topics which can be quite difficult for employees and their supervisor to have a conversation about. And one of these areas was sexual harassment. And what Virioc organised was in terms of having digital online toolkits. And this was where employees could go on and say they've experienced sexual harassment or they've overheard sexual harassment happening, such as a sexist comment, and what pathways can they have to make sure that when they hear that next time, what options they have. And I think this was such an innovative tool that people haven't looked at before, which will be available to more organisations after the pilot project. And I'm sure Claire will be able to speak about it a little bit more as well. But I think for us, this tool is really instrumental in terms of people having the confidence about what to do next time they experience it.
So we've talked about bystander action in the context of primary prevention. Now let's turn our attention to planning and delivering bystander approaches that align with best practice design principles. Natalie, what are the best practice design principles we need to consider when planning our bystander work?
Yeah, I'll touch on 5 key principles and then also talk a little bit about a behaviour change framework that we've used in conjunction with the Behavioural Insights team to think about how you can design bystander interventions. So first of all, with the 5 best practice, or maybe promising practice, I would prefer to say than best practice, because it still is an emerging space and there's a lot that we don't yet know around what does work, but I would say that we are starting to build that evidence more so all the time. And thanks to my colleagues who've already touched on some of these principles, so it's a really good introduction to some of what I'm about to say. But number 1, which Claire touched on, is about try and change the environment, not just individuals. So often we think about the bystander as being an individual, but as Claire said, it's also about challenging systems, norms, structures and practices within organisations. And so where you can make changes in the environment, such as making reporting easier, improving policies and procedures in place to support people making reports either as an active bystander or as a victim or target. There are new and novel instruments and tools that are being introduced in this space all the time. So the Razor toolkit was one that was touched on. But if you're into sort of technology, there's things like buying software that screens for gender discrimination, like language in emails and communications that can pick up on some of those behaviours within written communication. That is again about the system or the organisation being the active bystander. You can even get tools that pick up on who's talking within a meeting in terms of the gendered nature of who has most airtime in a conversation in a meeting as well. So there's all these new and novel things that are coming out all the time to support this work. So that's the first principle. The second would be around being clear about the behaviours that you're targeting, and this picks up on what Tracey said, is that what we find if we ask people in surveys or reporting tools to respond to the question, have you experienced sexual harassment or have you witnessed sexual harassment, we might get around 10 to 20% of the respondents saying yes they have. But if you use what we call a behavioural inventory, where you say, have you experienced or witnessed a sexist comment, have you experienced or witnessed someone being inappropriately touched, you really map out those behaviours, you'll get more like 30 to 60% of people saying yes, they have experienced those behaviours, which you could then go on to class as sexual harassment. So be very clear about the behaviours you're talking about when you in training or surveys or whatever it is in terms of your intervention. Then the third one, which is along similar lines, is be explicit about the behaviours you want active bystanders to take. So rather than just saying do something in the moment, you need to tell them what it is they can do. Either it's from, like I said, diffusing the situation through to reporting, knowing how to make a report, knowing that they'll be supported by their organisation, all of those factors when it comes to what makes an active bystander respond. What we found from the literature, there's a very large intention action gap when it comes to bystander behaviour. So often, very well-meaning programs and interventions will run bystander training and ask people at the end, do you intend on being an active bystander if you're faced with situation X, Y or Z? And a lot of people say, yes, I now feel more confident, I have the skills, but we know from the literature that most people don't go on then to be an active bystander. So where possible, and I'm leading into my other point about evaluate, and if you can, evaluate behaviour change. And that's exactly what we're doing through these randomised control trials. And look, we realise not everyone can do an RCT every day of their life in an organisation we're working with, but where you can, if you can do any kind of follow-up around, you know, six weeks later, a couple of months later, as a result of this intervention we did around bystander action, has there been a situation where they've now been an active bystander? If you can have a control group, that's even more fantastic. Maybe if you're working with 1 or 2 schools, maybe you could do an intervention in one school, have a control group in another school, and then offer the intervention to the second school at a later date so they don't miss out. So, you know, it depends obviously on people's resources and time and availability of, you know, skilled staff to be able to do it, but where possible, just evaluate behaviour change. Don't stop at knowledge and attitude or intention to act. And don't stop at training. That would be my last point. Training is wonderful and absolutely needed in the context of other whole of organisational approaches, but we know from in terms of delivering just training, that's not going to change people's behaviour. So there needs to be a mix of strategies. So that's the principles. I just want to briefly touch on the AEST framework, which, as I said, is a framework that the Behavioural Insights team in the UK and in Sydney use to inform all of their social policy initiatives. So the AEST framework is simply about making it easy, making it attractive, making it social, and making it timely. So they use these 4 principles to inform their work with us around bystander action. And when we mean making it easy, again, make it easy for active bystanders to either report or actively bystand within an organisation. So like Claire said, they must feel supported by the organisation. We know previously that people who do bystander training and then go back to an organisation that doesn't support the primary prevention of violence against women or doesn't support any action around gender discrimination or gender equality, the backlash they get can be quite detrimental to their well-being. So they have to have some sort of support at that organisational level. In terms of making it attractive, what we're experimenting with these randomised control trials is email communication to students and staff at universities that kind of uses social norms and language that encourages people to be active bystanders. So by making it attractive, say you want to send out email communication to people within your organisation about how to be an active bystander, personalise it. Say, hey, John, did you know that being an active bystander only involves these 3 steps or something? Making it personal to people is more likely for them to engage with the content. Making it social, so the 3rd point, social along similar lines, you might use social norming techniques such as, say you did a survey of your staff and you found that 9 out of 10 people actually support you as a workplace doing something around gender inequality or sexism. You can use that then to say in your email communication, hey John, did you know 9 out of 10 people in our department support us taking a stand against sexism? And so people go, oh, actually, our organisation is serious about this, and everyone in my team or my organisation also supports this. So if I'm going to be an active bystander, I'm more likely to be supported by people in my workplace. So that's how you make it social, drawing on social norms when you can. And then timely is the last one, and that's pretty self-explanatory, but try and introduce bystander initiatives at particular transition points or times, such as the introduction, it might be O Week in a university, you might capitalise on the work Christmas party coming up, or sort of a situation where you can launch an initiative that corresponds with some of the most risky times for sexual harassment.
Thanks, Natalie. That's an excellent framework, the AEST framework for making behavioural change theory really practical. Excellent. So I'm wondering if any others have any comments on design principles or change theory in relation to bystander.
So as Natalie touched on, this is a really emerging space, and it's so exciting to hear that there's so much innovative research happening here. Victoria Police is a really interesting testing ground for this because we were trying to empower bystanders to take action, and the initial approach was on a compliance. You must do this or else. Obviously, nobody bought in because not only did they not feel safe in the environment, they felt as if they'd be penalised if they did something the wrong way, and so that was really ineffective. The next, I suppose, messaging journey that they went on was an attempt to get the men in the organisation to feel like it was good for them. So, gender equality is good because you get more flexibility. So you'll get to spend more time with your kids at home. So if you call out, this happening in your environment, you're enabling a culture where women have better outcomes. That didn't work either, because what's in it for me is a nice approach, and it's an important part of a behavioural change journey, but it doesn't get somebody to speak up. If somebody in a workplace says to somebody it's something really offensive, you're not going to be, well, what's in it for me? Maybe next Thursday I'll get the day off early if I call this out. It doesn't work. What's working in Victorian Police is making a nexus. So rather than focusing on the micro level, the relationships and the interactions between one person and the next in the workplace, lifting up to the macro and talking about, as we all know, that violence against women is on a spectrum and it exists in a cycle. And bystander intervention is a really critical part of that entire community response to violence against women. So if you tell somebody that in their action they're a really important part of this link between what other people say and the enabling culture that ends up hurting other people, they then feel more empowered to speak up. So that, what was the attractive? The attractive and easy is really, really challenging. But once you find that lever and make sure you get all somebody's individual hooks, including you are part of this systemic response to harm, you see really good outcomes. And that's what we've seen in Victoria Police, which is really encouraging.
I might add as well that I think one of the roles maybe, or that having a marketing or a comms team can bring is, we're talking about, I feel like a lot about how we draw on each other's expertise. And I think one of the things that for me personally, working on the Doing Nothing Does Harm campaign in particular, is that we have had the luck and to work with a really excellent advertising agency. And I think probably everyone in this room would agree that the advertising industry doesn't always do the best things for women and gender equality, but they do know what they're doing. And so they have an enormous body of evidence and research and best practice principles to sell us shit, and that we can take that knowledge and implement it for much better practice. And so I think drawing on all available knowledge that might often be outside of our sector, but to kind of, take that and flip the coin and use it for our own purposes, for social marketing as opposed to kind of retail marketing. It's not always easy to transfer that over, but that it's an extremely successful industry, and I think there are definitely things that we can learn. One book, if anyone's a reader, that I would suggest is called The Advertising Effect. It's by a man called Adam Ferrier, who, full disclosure, is the director of our ad agency. Not paying me to do this, but I read his book at the start of working with him, and I found it extraordinarily useful in going back to the points that are being raised here around really thinking about what is the behaviour that we're talking about, and just the level at which we need to be specific and strategic about identifying that behaviour. We cannot do a scattergun approach with this stuff, as frustrating as that can feel, because we all know how big the issue is. But this book, The Advertising Effect, I found extremely useful for really thinking strategically about that, as well as about target audience. We can't talk to everyone in one go. The Doing Nothing Does Harm campaign, as an example, only aims to speak to 25 to 35-year-olds in Australia with a slight male skew. That's it on one hand, but on the other hand, being that specific gives us enormous opportunity to really be targeted and really use the language and making it easy in a way that's easy for 25 to 35-year-olds. What's easy and attractive for a 25 to 35-year-old male is very different to a different member of the community. And if we had attempted to take a real scattergun approach to that, the campaign would have been a flop. And it's not a flop, it's doing really well. And I genuinely believe that part of that is kind of drawing on that skill set that our sector has, but also that the advertising industry and that kind of, the other side of the fence often can also contribute for us in this space.
Yeah, can I just add to that? An important point for us was, or even though the research that we're doing around the randomised controlled trials are very, research heavy and, what would you say, kind of trying to take something that's a real world experience and focusing on that in a research environment. The work that we did with the two universities was also very driven by co-design processes with young people. So we made sure that in the design of the interventions that we involved young people at all steps along the way, so that the intervention would fit in terms of their perspective of what bystander action is and what would work for them in the university environment. So that involved consultation with young people, but it's also involved doing a pre their norms and values around.
Thank you.
Order of our questions, but Natalie, kind of what you were saying has kind of segued into a question that I had for Tracey. To audience and skills and confidence within that context. You've worked in a number of different contexts with a range of different audiences. I wonder if you would like to share with us your learnings from that and how you did the tailoring.
So one of the projects I'm currently working on is working with 10 different sports clubs across 8 different codes, and what we decided to do with this project was actually run 2 focus groups, one for the male champions of the clubs and one for the female champions of the clubs, which range from committee members and players. And the first night, the male committee members and players said, oh, it's because council doesn't build us the facilities, the women aren't coming. You know, if you give us the new change rooms, the women will just be running to our club, and those sorts of things. And then the second night, we had the female committee members and players, and they said, no, it's actually about the culture of the club. You know, we would come if there is whatever facilities, but it is actually about the culture. We're sick of being put second best, not getting the support of the clubs. But the main thing they spoke about, and the term they used, was banter. But a lot of it is obviously sexism in terms of being put down, and those sorts of slogans like, you know, you kick like a girl, you play like a girl, and they said, we want to play at this club, but we actually want to receive the same level of support as the men. And so from that focus group, we realised that bystander training would be very important for them to develop their skills and their confidence. But also, when we brought both the men and women back together, I think the men were quite shocked with what impact that is having on them, that they thought this banter was actually bringing the 2 teams together, but really it's actually dividing them more, and that, you know, is impacting some women not coming back to the club. So what we really did was, in terms of workshopping, okay, well, what are some of the examples that you are hearing in terms of the clubs, and how would you respond? And as a male champion in your club, how would you respond if you hear your fellow teammates saying this to one of the female teams? So what we've really looked at was in terms of tailoring it to that context. And another example at the moment is working with our faith community as well. We did very similar in terms of what do you want to do to be able to prevent violence against women in your communities, and bystander action came up in that as well. But it's very much what Nat was talking about in terms of code design. What examples would you hear, you know, at your mosque or at your church, and those sorts of things that you can relay, and it's that really practicing. And I think for some of them, you know, of course it depended on who said it, but I think in terms of them understanding that they can support the person afterwards, or look like disapproving that comment and those sorts of things, I think that really helped them to understand, okay, we don't have to say something in the moment until they build their confidence up. So I think looking at those number of different steps and approaches have been really helpful for the different contexts.
Great, thank you. So the next question is for Claire. Claire, power dynamics at play in the context where the bystander is situated may affect a person's ability to take bystander action. How do power dynamics in organisations pose challenges for bystander action, and how can we take these into account when designing and delivering bystander programs?
In most organisations, you have a triangle hierarchy, and in most organisations, the women are at the bottom and the men are at the top. So you already have a power dynamic where it's very gendered, and those gendered power dynamics, we know from the research, mean that harm is enabled, it's walked past, and the system's supported. So in any organisation like that, it's a really, really challenging, multifaceted approach to empowering bystanders to take action, because your leaders are part of the system that creates harm, And very often, unfortunately, the leaders are also perpetrators. So when you're telling particularly lower level employees to speak up, you're putting them in a really unsafe environment where they might be in a room with a perpetrator that they know is a perpetrator. They've seen their experience speaking up, so they're going to stay silent. And in Victorian Police, there's a really interesting example where senior leaders have been identified as not just perpetrators but complicit in their behaviours. So one step we took initially was to empower those leaders to recognise their part in that enabling culture. And that's a really challenging thing for something to say, to look at themselves and say, actually, I reflect on my career, I reflect on how I've treated other people, what I've walked past and what I've enabled, and I was part of that harm. And acknowledging that harm and your role in that harm as a leader publicly is a really important, empowering thing. And it's the first step to looking at a system or an organisation and changing those power dynamics and that hierarchical structure. When a leader comes forward and saying, actually, I screwed up and I can do better. And then when that leader starts to behave differently, they empower the people below them to behave differently. But this is only part of that, systemic, I keep using the language systemic, that approach to challenges in power situations, because you also need to empower from the bottom up. So you need to get those people at the ground level who are often in really unstable employment relationships on contracts. They're not being paid very well. They're more often in part-time working arrangements. As I said, they're more often women. So they have a vulnerability that the leaders don't. And you need to make sure the policies and the systems around them support them to speak up and call them out, which again needs the leaders to come back and say, if you, a vulnerable person, see something and need to say something, I will support you in saying that. So you really need a whole of institution approach, and that's really, really hard, but it starts with the leaders and it starts with accountability. And things like public apologies for harm are really, really meaningful in this context, particularly for people who've experienced it. And people saying, if you see harm and say something, under my watch, under my leadership, we'll make sure that you're safe.
Great, thank you. Do any of the other panellists have anything to add to that? All right. I'd like to then consider power dynamics more broadly. And this is a question directed to the whole panel. Thinking about intersectionality and multiple forms of discrimination or privilege, can you give us some idea about how we can factor in these complexities when designing a bystander program, approach or initiative?
I'll start. I guess in relation to intersectionality, when we're thinking about an incident or a situation in which there may be bystanders in the room and we're encouraging someone to be an active bystander, I guess we have to think about in terms of the role that men play in relation to calling out behaviours or playing that role as an active bystander, is that men themselves, I guess, can experience the power differential that Claire was talking about, in that, often we're saying men need to be the ones that call out the particular behaviour, and the evidence shows that, I guess that unfortunately men are more likely to listen to other men as active bystanders as opposed to women. But there is sometimes that difference in relation to men in the room still have a power difference between them. So whether they're the perpetrator may be a particular male, the active bystanders who are also male in the room may be of a different power due to many factors around ableism, class, their own sort of previous experiences. So I guess in terms of that perspective, we can't always think that men are of an equal power within a situation, being able to then call out other men, because often there are those power differences due to reasons of intersectionality. So I'm talking about it from the perspective of men's difference as opposed to women's intersectionality.
Yeah, I think that's a really interesting discussion when you often hear men say, well, not all men, and often there's pushback against them saying that. So something there I think important for us to acknowledge and maybe interrogate a little bit more closely as to how we're supporting systems and organisations and education to articulate that intersecting, that sort of range of power dynamics within groups of men. So I'm wondering if anyone else has any thoughts on that or examples of how that might play out in the bystander scenarios.
I think that representation is a really important thing to think about, and I'm a really privileged white woman, and with that comes power, and with that also comes a real risk that you don't see intersectionality, you don't understand the impact that it has on somebody's safety in the workplace, their ability to call out a culture and so on, because as we know, as workers and practitioners in this space, every point of difference you have away from the dominant power means that you're more vulnerable and you're more unsafe. And it's one thing to empower a privileged white woman to speak up in the room, but when you start to experience other forms of intersectionality and those attributes affect the power dynamic that you're in, you're less and less safe to speak out. So if you're a practitioner in this space, I think it's really about acknowledging how intersectionality affects safety and how it impacts somebody's ability to drive change because they're disempowered because of who they are, because of how our social structures work. And I think one really powerful thing you can do is give the room to somebody else. If you're speaking about this kind of work in a context, reflect on what kind of privilege you're holding, what kind of power you're holding, and hand over the conversation to somebody who might have more lived experience of what it's like to be a really, really vulnerable bystander.
I think that's a really good point about reflecting on our own privilege and that's actually quite a deep and can be a very challenging process, can't it? So in terms of what organisations can do to support people to have those opportunities to reflect in safe environments with communities, and we run communities of practice, and that's often a very powerful space for doing that work. Very productive, actually. So thanks for bringing that up. Does anyone have any other thoughts around
Just a very small comment. I think that where resources allow, that of ensuring that your research phase for any intervention you're coming up with, whether that's an advertising campaign or a training or something, draws on the widest breadth of life experience that it possibly can. I think it's much more effective and much more ethical to begin with best practice as much as possible than attempt to retrofit something that you kind of realise maybe actually only drew on the experience or the expertise of a particular and usually quite privileged group of the community, but of really doing our best of working with, there are researchers who, have that very specific set of expertise about ensuring that all voices are, it might be an Australian representative population, or it might be over-indexed to a particular group that tends to be ignored, that things that really bring in those voices in the really early stages of your planning so that everything that comes afterwards, right down to a finished product, is drawing on the widest breadth and the least heard, in particular, kind of voices in that community, so that you've got those solid foundations to then build on, is, I think, much more likely to produce effective work than getting, 80% of the way through and kind of going, oh, we actually didn't do that thing very well. Retrofitting it is never going to be as effective for impact and outcomes.
I think that's a good point, especially with respect to generally and more broadly organisational management and practices for the whole community, really. So not just in terms of a specific bystander approach or people approach, but looking at sort of ongoingly cultural change in organisations. And I'm particularly interested in, the folk who are most vulnerable, for example, folk with lived experience that are working in organisations, and the difficulty sometimes in advocating for themselves and speaking up for themselves. So I'm wondering if anyone has any comment on how that might be facilitated in organisations, so that they don't need to put their hand up and say, you know, we're not being taken into account.
Victoria Police are leading a conciliation process with the Human Rights Commission at the moment, and the focus is restorative engagement to address harm across somebody's employee life cycle. And we're having people who experience workplace harm, discrimination, harassment, predatory behaviour, you know, when they were 20 and in the academy, and now they're in their 50s in senior leadership. They've never talked about what they experienced because they're not safe to. They've never been heard. And so, facilitated by our incredible conciliators at the Commission, they're sitting in a room with a senior leader and they're telling their story in a place that is safe to tell their story. For them, it gives them the very first outlet, and usually the first time that anybody's ever listened to them, which is a really powerful, really challenging experience. And for the senior leader in a room, it means that they hear the lived experience of somebody else, and they see a person rather than a policy or a strategy or a system, which is usually all they interact with at the higher level. And we have power under our legislation to facilitate an agreement where some compensation to recognise the harm can be paid. There are redress and restorative engagements programs across a number of different reform projects at the moment, in a number of different reports, like the Royal Commission into Institutionalised Child Abuse. That is a really, really powerful process to let people come forward and let them speak when they're not safe to speak, but it's often not available. So for organisations and systems that are trying to look at themselves and figure out how they can help people who do have that lived experience, they can look at ways to facilitate, you know, even just that, having that conversation, letting somebody be heard in a safe place for the first time. It's a really powerful thing. And for people who do engage in those conciliation processes, they come out saying, for the first time, a weight has lifted. I feel like I've been freed after 20, 30 years. You know, I've been able to talk about this deeply harmful thing, and the organisation has listened, and I feel safe again.
Thanks, Claire. That's a fantastic example. And again, wondering about workplace cultures and what organisations can support in terms of everybody feeling that they can speak to their lived experience and have their story heard, and the power of that, creating connections and empathy and supporting bystander work culturally.
Can I just add quickly to that, we also have to be really careful about what interventions we introduce in terms of ensuring that they don't make matters worse for women in the workplace. And I guess there's more evidence coming out around this in relation to not losing our gendered focus on the work. And an example of this is there has been quite a large-scale evaluation around organisation-wide mandatory diversity training, which diversity training for a long time has sort of been, I guess, thought as the answer to talking about these issues around intersectionality, talking about you know, various behaviours in the workplace. But the evidence is now showing that at best it does little in terms of having any outcomes, and at worst it can actually make things worse for women. Particularly when it's mandatory. I must stress that part around the mandatory component, because it brings people into a conversation or a setting where they don't want to be, and where the potential for backlash is quite significant and can create worsening cultures for women in that instance. So we need to be mindful of that sort of learning as well.
Yeah, good point. Thank you for that. Leading into the last question for our panel today. So thinking of what tools and resources that you might speak to in a little bit more detail, and you've all mentioned some fantastic tools and resources today. I see everybody's been furiously taking notes about those. But if you'd like to share some of the key ones that you'd like everybody to know about for practitioners in terms of their work in designing and implementing and evaluating their own bystander initiatives. So I know Natalie Vic Health has some on the way, so if you could start talking about those.
So pretty much everything I've spoken about today will be in a resource. So as a result of sort of the last 2 years of scoping the literature and working with the behavioural insights team, we'll be producing a guide to developing, designing and evaluating active bystander initiatives, and that will be out hopefully mid-year. In addition to that, depending on the outcomes of the trials, we will have various tools and resources available. Of course, in the interest of knowledge transfer, we will share the results of the trials either way, if they're successful or not successful, because they demonstrate what, learnings for us about what we should or shouldn't do in various interventions. So we'll have potentially some tools for universities in relation to bystander approaches. We currently have a rapid review on our website, which was done by Deakin last year or the year before, which looks at bystander interventions, and particularly though it looks at more around the sexual assault literature as opposed to gender discrimination or sexism, just because there's not a lot out there. So the rapid review could only touch on what's available.
Such resources that have been recently published, we're going to promote through the PiP network and the bulletin, so keep an eye out for that as well.
Sorry, can I just mention one more, not from Vic Health, but from our partner organisations. And many of you might be aware that Gender Equity Victoria has recently launched their online active bystander resources. So if you jump on their website, there's a short video and also a sort of a sexism online.
Not only that their organisation might have produced, recommend, or they've drawn on themselves for the design and
we have a lot of resources online about not just legislative and legal supports that are out there through our organisation and others, but also really accessible tools on how to talk to people about issues like sexual harassment in the workplace and gender inequality. Also some gender empowerment. And Tracey, I think you touched on an amazing pilot project looking at how bystanders can be empowered. There's some content on our website as well, so encourage you to check it out. It's called Raise It.
I might just add that Doing Nothing Does Harm has a website that there is tools and resources on, and that we are developing with our practice leadership team some additional video content that is specifically for practitioners. That will be done by the end of financial year, because that's when our funding runs out. And then also as an international example, and I might get this wrong, but I believe it's the Southern Poverty Legal Centre in America. They have an incredible how to have bystander-based conversations every day, and we drew on kind of what their style of talking in the development of the campaign, and I found really useful.
thanks.
The Southern Poverty Legal Centre.
And of course, examples are great, aren't they? We can talk about theory and approaches, but I think examples really bring that to life for all of us, and give us some ideas about exactly how we can act ourselves.
Actually, on that, yes. What we found from the behavioural insights literature is that if people make a pledge or a plan for if X happens, I will say Y, that they're more likely to do that when the situation arises. So absolutely having examples or ideas in your head of what you would do increases that likelihood.
That's right, and I know from our work in schools that teachers are asking for more or less scripts and drama enactment activities with the children so that they get that opportunity to do that.
Also thinking about the commitment and buy-in level from leadership. One of the tools we found really useful was being the Listen, Learn and Lead local government program, which was in terms of the CEO having open conversations with groups of staff members at Monash. And this was originally supposed to be more around the barriers to women in leadership, but culture came up a lot and intersectionality came up a lot in terms of this, in terms of the number of different barriers a woman had in terms of her race or sexuality or ableism within the organisation. And for our CEO to hear this firsthand, it made her feel that she really did have a role, particularly in the bystander action space. So that's a great resource as well to have a look at. It was developed by DELP.
Thank you all. And if any folk out here know about resources or tools that they think we'd all like to know about, please do follow up with an email to us and we can endeavour to share those with everybody. So before we go to questions from the audience, I'm wondering if you feel there's anything that we haven't covered adequately or brought up in the conversation today that you'd like to speak to or elaborate on a little bit. I think it's been awesomely comprehensive and terrific. So I'll offer a minute or two to everybody to perhaps chat with your person next to you about what you've heard today and to consider some questions that you might ask of the panel. So let's just have a minute to have a little reflection and talk about that. Thank you.
I think this is good.
All right, everybody, we might bring our focus back to the panel and think about the questions that you might like to ask. So would anybody like to go first to pose a question to one of our panellists or generally to all of our panellists? Yes, the person up the back there.
Consistency of language is really, really important, and the messaging. And been to a couple of recent conversations about bystander action, and the language, is talking about upstander or active bystander. So I'm intrigued by the panel's thought about that change of language.
We've had that exact same dilemma, Fee, in terms of talking about, do we use upstander, do we use active bystander? And I think really it's, there's no right or wrong. I guess it's whatever resonates with the population you're working with. We've stuck with active bystander because that's what we've used consistently over a number of years. And yeah, upstander was a bit of a new term that we didn't feel ready to go with, but others are using it in training and in other situations. So yeah, I guess there's no right or wrong, but yeah.
I might add to that I absolutely hear your concern, and from the marketing kind of perspective of this, obviously for all of us, but the language that we use is really all an ad is ultimately. And one of the really interesting learnings for us in our developmental research phase and then concept testing, so we took an early version of the ad to groups of members of the community and kind of got their feedback, is that for the group that we were attempting to talk to, the language of bystander or kind of versions thereof really, and I think someone mentioned this earlier, for them resonated with intervening in violence. And so when we tried to use the language of bystander and then paired that with asking people to do something about sexism or disrespect and those, the drivers of violence, they just didn't get it. They couldn't get past the pre-association they had that bystander meant ringing the police or knocking on your neighbour's door. And so we dropped the language entirely. You won't see the word bystander in the entire Doing Nothing Does Harm campaign. I know that I use the words because that's kind of what we end up using in the office, but for us as an organisation and as a team, I think it was a real learning opportunity that the way we talk about things and maybe industry jargon and kind of maybe more academic language might make sense to this audience, but when we try to talk to 25 to 35-year-old men who were at dinner with their mates, actually they didn't really they didn't talk in the language of who that person was. It wasn't about a label of a subject, it was about labelling the behaviour. And so they really resonated with the language of do something or show your support or speak up or, support a woman or support another bystander, because they resonated with action-based language. They actually didn't care what that made them. And the framing of it of you need to be this thing, a bystander or an upstander, some of the feedback we got was that actually felt like too much pressure, that it meant, and they worried then about all the ways they could do it wrong. What if I do bystander wrong? Whereas going back to the point that was made earlier of being really specific, if you say to someone, have you been sexually harassed? But then you say, have you experienced this behaviour? They resonate with behaviour-based language. And so that's not always a viable option. I know, there are spaces and ways that we need to be able to talk about this issue with a label like bystander, and I think that that's really relevant. But it's just an interesting learning, I think, from our experience of developing an advertising campaign, that people didn't, that language actually took them down a garden path we weren't interested in, and then also they were much more focused on action-based language. What do I do? Not who am I, or what do I do? Which I think is interesting.
Yeah, it's about that behaviourally specific issue, again, is important. So, if you see an incident, you will do X, Y, Z, and that's what we've used in our email communication with students and staff at Melbourne Uni, is that we've focused on a different behaviour every week in the email communication. So one week might be a sexist comment, next week might be, inappropriate language used in a situation. And so I don't think even in the emails we use the word bystander. It was about, if you see X behaviour, what would you do? Here's some examples of what you could do in the moment or after the moment.
And also at a personal level and a system level. So yes, always considering that. What an excellent question and responses. Thank you. Does anyone else have anything to remark on that question? Okay, let's go to somebody else. Is there anything that was discussed that you'd like a little bit more detail on or clarification about that you thought was interesting? Yes.
Hello, I'm Tanya. Thank you so much for coming and sharing your expertise. The question was probably more for Claire, but if anyone else might want to answer. You spoke about making pathways for the client, the police, in order to engage and see it as their issue. I'm wondering if there's any principles. I mean, I personally speak to communities and schools, men, boys, so I'm looking for those pathways a lot as well. And I know it's a different dynamic. I've got a one-off where you're working with them continuously. I'd love to hear thoughts on how to identify that, and are there any principles about finding those pathways?
So, thank you. So do you mean pathways to allow people to identify the issue and why they should respond to it?
Oh, it was just, I wrote down this what you said. So you said you're finding pathways to what is important to them.
Sure. So for the individual, that's a really, really challenging question, which is why sometimes systemic intervention is actually easier, because changing systems is usually about starting with policy and leadership. But when you're talking about an individual, where complex creatures that are socialized to respond to things in a particular way, to think in a particular way. And changing behavior is one of the most challenging things that we can do. This entire, marketing and advertising, it's all about changing behavior, as is everything that we do. So the pathway question is a really difficult one, and often you need to have a specific understanding of the environment you're operating in, just as Natalie picked up on. So primary prevention starts with children, as we know, in the childhood sector. And so if you're working at that level, it's understanding what drives the behaviour of children, what is their social context like, what is their operating model like, how can they think, how do they understand information, how do they interact with one another, and you intervene at that level. Children understand principles of fairness and equality. So a message around, you and I should have the same thing and have the same opportunities, they will understand. But if you dig a little bit deeper, there's a really great UK advertising campaign where they got a bunch of school children to draw pictures of a pilot and a firefighter. A lot of you might have seen this. And they all drew men in these very male-dominated professions. That is a real starting point. They brought in a bunch of women from all those professions, and look on the children's faces when they were confronted with a different image of those kind of character, the stereotypes they had in their face was really transformational. This is a really simple example. But in all these different contexts that you're all operating in, understanding your community and the environment that you're working in is the first lever. So what drives them, and what are the interactions they will have in their everyday, professional, social lives, and how can you intervene at those really personal steps to see where they might be able to get a message in. And, I talked about Victoria Police. The thing that's really resonating is they see themselves as part of a system to respond to violence against women. So 40 to 60% of their operational call-outs are about domestic violence incidents. So most of their daily workload is responding to violence against women. And so once they saw how they treated each other in the workplace as part of that system of intervention, they were then empowered to be part of responding to it in a different way than just being frontline police. Is that a helpful response?
That question got me thinking of the EAST framework, actually, and wondering how that might apply to school context.
The easy, thinking the easy is that also not just relying on people or young people to make reports of incidents, to then be able to track over time what the prevalence of behaviours is. If you can be proactive and have some sort of survey or mechanism to track what the culture looks like in terms of, the experience of sexism and sexual harassment, that's then making it easy for you to understand what some of those issues are, rather than just self-reliant on, those reports. The other thing I was going to say is, in terms of working with young people, say within the school environment, I guess it's also giving young people the space to be involved in, as I said before, co-design processes, to really talk about what issues are coming up for them, we worked with a group of young people on designing a resource around pornography. And what we found is when these were particularly highly vulnerable young people, and what we found is that although we had this initial outcome from the outset was about trying to talk to them about pornography and their use and understanding of pornography, it led us down a very different path around their experiences of learning about sex, sexual well-being, and all these other things that for them was part and parcel of pornography. So I think for us, sometimes you have an idea that you want to do in terms of, say, a bystander program, but just giving young people the space to talk about the issues might then create a whole different pathway of where you go with that.
Thank you.
From your question kind of about is there principles or kind of frameworks that can maybe be applicable to different scenarios, I think that one of the most important things is that none of us in this room are a member of the target audience. We can't be. We know too much. We bring our own set of biases. We know all of the background research. We know all of the theory. So of really trying to draw on inputs, whether it's kind of, co-design or other forms of research or, other readings in academia and things, but that of really trying to, as best as we can, step out of our own heads, because we can't be, I am the age group that Doing Nothing Does Harm attempts to target, and I am absolutely not the target audience because I built it. Like I know, I know too much, and I've studied gender, and so I can't look at a draft of a video and go, that'll definitely work, because I come at it with a set of information and a set of conversations and a safe space, because I work at Our Watch, to think about these issues. I can't ever put myself truly in a headspace of someone that I'm trying to influence. And so of really trying to stay, easier said than done, but really trying to stay conscious of that when we are designing and we are thinking about these things, that we have to draw on external resources as kind of an underlying principle, I think is, I know I fall into the trap of going, oh, but I wouldn't do that, or that would definitely make me do the thing, and I'm just not the right person to be applying those assumptions, because we're too in it. We care too much.
Yes, you've brought up a really interesting question. I might ask one actually. So you talk about, we do, as professionals in the area, often have a lot of knowledge and theory, arguing for gender equity and bystander action. What about the emotional resourcing that you need to, as well as knowing how to act, actually cultivating the courage perhaps to stand up and act? And I don't know if we've really talked much about that side of things. I wonder if anyone can speak to practices or cultures around developing empathy and compassion and courage.
I can talk a little bit about work that we've got underway around the theme of healthier masculinities, which is where we're heading, hopefully, for the next couple of years with some of our investments, because I think it really touches on that in terms of, what it means for men to have that connection in terms of empathy and emotional intelligence, and how we support young men and boys to develop that, which would then potentially lead on to active bystander behaviours. This is, as you know, this is kind of a hot topic at the moment around work in relation to men and masculinities and gender equality. And so I've got really not much to say, that just watch this space in terms of where this work evolves, and hopefully we may be able to potentially look at developing some framework for action around interventions which support young men and boys in relation to gender equality, and potentially fund some new interventions in the community.
One traditional book which I'm sure you've all heard is we have a mother, you have a daughter, you have an aunt. And I think that's been a really commonly used narrative in the space to make people connect emotionally to why this work is important. And as you probably would all know, the problem is that you make women only important because they are somebody in relation to a man. And there's been a lot of work to move away from that narrative and to try to operate in a different context. to each other by seeing themselves in them, and the further away from themselves somebody is, so we talked about intersectionality before, the more difficult it is for somebody to understand and then emotionally connect with that person. So we often talk about linkage spots, so finding that linkage beyond, you know, giving somebody a relative or a loved one that is a woman. So often that is making somebody relate to somebody's harm. So we have leadership-led learning where leaders will come up. So for example, a woman will come up and talk about something that happened to her that really impacted her among her career. So she, you know, not necessarily related to her gender, but a particular harm that she experienced that impacted her, and having those open conversations in a safe place. Safe. Everybody has been emotional link where you see the other person as a person just like you. That is the spot where on an individual level you can start to drive those conversations around change.
Thank you. I think you explained that really well. Yes.
I might just add that in regards to bystanders, particularly in the question of courage, that the research we did for Doing Nothing Does Harm really showed that by far and away the main concern that people had that was, people who could identify sexism, so the group that kind of could see the issue but weren't acting, that the key barrier they were telling us was that they didn't want to be a party pooper. And so this concern that doing something would mean that they ruined the vibe, or that they might make it worse, or that, you know, but it's about them, you know, they don't want to be the person who makes crickets happen in the room, was by far and away the biggest thing that was concerning to this group. And so that's why for us in the advertising and the supporting materials we have for the campaign, it really shows positive outcomes of doing something, but keeping that realistic. You know, we don't, the flip side of that, I guess, is that people were saying, you know, if an ad was to show that someone says, mate, that's not on, and then like that person like falls to their knees and begs for forgiveness, like that's never going to happen. And so of kind of almost finding that sweet spot of people needing the kind of social reinforcement that they can say something, and it can just be a small thing. It can be an eye roll, or, you know, someone tells a sexist joke and you go, I don't get it, even though you do. You say, I don't, you know, little things that can say something without ruining the party, was the balance that people really needed to kind of feel courage to take that action, that they knew they weren't going to wreck stuff, basically. And that was, you know, as soon as people could see a version of it, an ad that tried to do that, they were saying they felt that therefore much more upskilled and much more motivated to attempt to do something next time.
Yeah, great point. So do something, even if it's a really small something. Everything makes a difference. And actually, sometimes the smallest somethings can make a really big difference, can't they? You know, we've all remembered a kind word that one person said at the right time that might have changed our whole lives, really. So thank you for that. Does anyone else have any other questions? We have another 10 minutes or so for questions. Or were there issues that were raised, or tools that were mentioned, or something that you'd like to hear a little bit more about? Yes.
Hi, I'm Irene from Eastern Health. We're working with community and schools with bystander action at the moment, and we're just trialling something we developed, and we've delivered it to a few schools so far with good feedback. But I've really been thinking about what you've been saying about, well, would they actually do anything? You know, they know the information, but would they actually do anything? And what we've asked them to do, and I think this is a really important step and something that we have learned while we've been developing our practice, is that you first start with yourself. You examine your own attitudes and behaviours. And that's a crucial step, because going into a room and imagining that everyone's ready to take action and now you've got the information, they might need to come to terms with what they've learned and process it for themselves before they can do anything. And for some, that's enough. And the other point I want to make is we're based in the Yarra Valley, at Community Health in the Yarra Valley. The Yarra Valley Yarra Ranges has one of the highest rates of violence against women. So when we're talking to community or schools, who are well aware of this. We can't say, you know, we're just talking about sexism and discrimination. We've got to be clear that they know people who are experiencing violence. And we've got to add, like, if you think you can call the police, call the police. If you think you can take action. But we stress personal safety and involvement and the parameters around that are important as well. But for us, it's just a learning space. But this is something the community has really been asking for. And it started from Griffith University MATE training. You might have heard of it. We had them down to train 10 community leaders, people who were interested. And that's how it started. And then when that license ran out, we developed our own, having them learning from that first year of what happened. That's all from me.
Thank you. That's a great example, actually. Any remarks on that?
I just wanted to comment on, you said that you were wondering, you know, how you could figure out whether or not people were actually, you know, in this context who received the learning programs were seeing change. We find that confidential survey tools are a really great evaluation method. So all you really need are a few kind of hypotheses that this intervention will result in, you know, more people speaking out, you know, in the schoolyard or the classroom when something is said that's inappropriate or harmful, and having, you know, one control group that didn't receive the intervention, one that did, and getting them to self-report what they call out and then what they see other people calling out. And those, I mean, they are such useful bits of data for, you know, this community, because if we see your program as really successful and, you know, or even moderately successful, and there's a rise in bystander intervention, we can take learnings from it and it can be brought into other schools, and this is how really promising change occurs. So I'd be really excited to read a research paper about what the outcomes were, and I think we all use different monitoring and evaluation tools, but I'd be really happy to talk about some of the ones the Commission uses and share them with you if it's helpful.
And likewise, post the trials, we might be able to share the tool that we used. We probably will be able to share the tool that we use, which is like a pre-post survey of what we asked people in relation to bystander behaviour.
Thank you, and I'd like to emphasise, as an educator, the point that you brought up, the importance of creating safe space and plenty of time for critical reflection on what you're learning all along the way for everybody. Okay, right, yes.
I was just thinking then, something that hasn't been discussed too much today, but I have found has been useful in all the different contexts is sort of setting you know, team values and behaviours, and it's often, you know, people find it really helpful to go, well, what you've said doesn't align with it, or sort of just really being able to pull people up. And I think that has worked well with our Sports Club project, but also with our with just our team at work, that you know, the comments like, oh, I'm going to man the phones this afternoon, and I sort of look at her and she goes, oh, yep, no, we're not allowed to use that language anymore. So it's sort of humorous, but also, you know, it's just trying to change the language in our workplace as well. So I'd add that.
Thank you. So it's about creating cultures, isn't it, and having you know, values and behaviours and rituals that are consistent. And, bring everybody on board. Thank you. Is there anyone else with a question or a comment? Something they'd like to know more about? Yes.
What is your thinking at the moment about the binary concept of gender, and how do you sort of unpack that and break that up to recognise a range of gender experiences, and then all these other intersections of people's experience which are inseparable? How do you kind of think about and apply that without using the message that it is gendered? So, for example, I had an active bystander moment recently where I asked an Asian man who was being targeted by an older white man if he was okay, and just kept saying, are you okay? Are you okay? Until the harassing person left. And for me, that was a really powerful moment, because it was also kind of breaking down the stereotypes of myself as a woman and someone who would do something. So I felt like it was a really powerful experience for everyone involved. So how do you sort of accommodate that complexity of experiences like that, everyday experiences, into your thinking about this work?
It's kind of like the other side of helping men generally to understand that masculinity can be empathetic and compassionate. So, you know, women shouldn't be constrained by the idea that they should stand back and let the men, you know, address the problem. But we can be brave and we can be active. And
when we were planning our interventions, we had a long discussion about whether our bystander interventions were targeting men and boys in terms of encouraging them to be active bystanders, and that's originally, I guess, in our discussions with the Office for Women, where our funding came from, was how we described the initiative. But as time has unfolded, we've realised more and more that it's about everyone being active bystanders, very, you know, not dependent on gender. And in our communications that we've used at the university level, we have actually been quite generic in that we're saying everyone can be an active bystander, everyone has the, you know, should stand up and challenge these cultures and norms and practices. So I think it's, you know, but some of the research, as I touched on before, does show that, you know, in some cases men are more likely to listen to other men who call out the behaviour. So there is some still gendered findings in relation to who's more likely to be an active bystander, or, for example, women in, I think it's aged 35 to 44, university educated, are more likely to be active bystanders than any other population group. So there's gender differences in relation to who is a bystander, which perpetrators, you know, which gender of the perpetrator is more likely to pay attention to another gender. So it's still, you know, there's I guess it is still a gender thing, but, you know, you can talk about it that everyone has the power to be an active bystander.
I just wanted to add that, you know, that we know that the binary is harmful. You know, in the binary are all the attitudes and the behaviours that hurt men and women and everyone who identifies in between or as neither. And this is one of the foundational challenges for, you know, everybody in the sector, that because we exist in this binary, you know, we drive the harm. But the binary is a really interesting enabler as well for empowering people, because we work around those dominant identities and empower people outside of them. So, you know, things like building communities, a practice of women who are leaders is one really powerful thing, and we see, you know, the next generation of people who will change these contexts come out of those forums because they're safe for the first time to talk up and to share their thoughts and, you know, develop the behaviours you need to become, you know, a leader in, you know, our still very binary culture. But when you're talking, I suppose, going back to your original point, as an individual operating in this binary with all the weights and expectations that come with, you know, what they say about who we are and how we behave, I think acknowledging that all these really traditional ideas about what a woman is, there's a lot of power in that. I mean, Jacinda Ardern's a lovely example, you know, a strong leader, a strong person, a strong bystander can be like you were. They can be empathetic. They can acknowledge somebody else's harm and pain. They can speak up and stand up in a way that is nurturing and respectful and kind, rather than, you know, in a traditionally masculine way. You know, speaking up and being powerful doesn't have to be masculine. It can be traditionally feminine, and there's a real strength in that and a celebration in that, I think.
Thank you. Well, I think we've run out of time, and I think we've just had such a fantastic, deeply theoretical and practical conversation here today. You know, my reflections are that, you know, you've shared a lot of best practice advice that I feel actually really hopeful and enriched by this conversation, and I'm sure you all agree that it's been a wonderful opportunity to support our work for social change. So I'd like to thank everybody in the panel for bringing their energy and sharing their wisdom today, and all of you for taking the time out of your busy work schedules to attend the seminar. So could you all show a round of thanks to our panellists? Thank you. And thank you to my co-facilitator Alice as well. And we'd really appreciate if you could fill in the feedback form that's on the back of your agenda. That really helps to inform the other seminars and further work that we do. There are some pens on the back table. And this way you can contribute to our evidence base around what works to build your capability in this arena. If you've been watching the stream online, you'll get an email with a link to an online survey later today. And I'd like to encourage you all to stay behind for lunch and networking and to share what you've learned and how you feel about today's discussion. And also we hope you'll come along to the Prevent X conference on the 21st of May. So come and speak with any of us and Queenie over there about the conference. Okay, thanks again everybody, and thanks once more to our panel. Thank you.
So you might have to get your list. I think I'll just stop. I'm gonna work out how to stop it. Bye.